फोन कंसल्टेशन, टेलीफोन पे सलाह देना, टेलीफोन पे रेट बताना, talking to the patient about the charges on the telephone. Should it be done? Should it not be done? Does it improve the relationship between the dentist and the patient? Let's see in today's video. Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 24 years of experience. I started my 24th year on this in this new year 2023, and apart from dentistry for 23 plus years now, I've been teaching and coaching colleagues on the topics of practice management, medical legal ethics, documentation, record keeping, and finance in dentistry. And in this today's video, I'll be dealing on the topic of phone consultation. Now, this thing has a correlation with one of the queries that I received from my WhatsApp community. I'm running WhatsApp community since 5 years now, since February 2018. Again, it is a free of cost community that I'm doing as an endeavor of giving back to the dental fraternity. So I received this query that I am not sharing my contact number with my patients, but sometimes I do feel the need that I should be sharing my personal number with my patient to improve practice growth. Does it really matter? Does it in any way build any good bonding with the patient? Because sometimes they discuss costing factor for a lengthy time. So I need your opinion. So of course, I'm not going to name the colleague who has sent me this query. Sorry. So my first answer to that respected colleague was that it is a personal choice whether you want to share your number or not. Remember, the more you conceal your number, the more it will get spread. So again, you can have your clinic number separate or a personal number separate. The number that you're using in your clinic for your talking to your patients can be totally separate than your personal number or your personal WhatsApp number. In any case, if your number is, you can say, workable or approachable or reachable only in the clinic hours, the patients are going to call you in the off clinic hours to get in touch with you, because there are instances when they need us in emergency. But if we are a 9 to 8 or a 8 to 8 clinic or a 7 to 7 or a 9 to 7 clinic, and whatever timings you have, then we are going to face this problem. So whether you share your number or not, whether you want to display it or not, it is absolutely perfectly your choice. It depends upon the kind of nosy patients you have, or the kind of, you can say, loopholes you have kept in your practice in that regard. But the bottom line is, number shared or not, secondary part. I do not encourage telephonic consultation at all. Maybe a little bit of instructions, maybe a little bit of, you can say, talk, but I always encourage the patients to come to my clinic. Why do I say that? Because I believe that I have good conversational skills via which I can transfer my prospective patient into my clinic patient. A prospect into a real-time patient, I can do that via my talk, via my presentation of my skills. And of course, once I've done the hard part, the even harder part technically is the treatment part and the satisfaction part associated with that. But then we need to remember very clearly that it begins only by a good talk. A good talk need not necessarily be a sweet talk. You need to talk in a dignified manner. You need to talk politely. You need to be respectful to the patient, but to conceal certain things from the patient or lie to the patient or make tall promises or over promise and under deliver, those are going to dig a big hole in your overall satisfaction experience for the patient. So I always encourage, please, if you want a good detailed consultation, please come to us in our clinic, have an appointment, and we'll discuss. Sometimes the patient will ask the price on telephone. Rate hi bata do, itne ka bata do. Some colleagues respond very, very rudely, or their assistants respond very rudely. No charges on telephone. Come to the clinic and get a quote. They'll quote like this. So there is always a way to talk. When the patient says, no, I'm sorry, just thoda sa mere ko range hi bata do, always give a range. What is your PFM charge? They range from 3,500 to 9,500. What is the difference? Please come to the clinic and we'll have a talk, or sir will have a talk if your assistant is talking in that regard. Because it is not at all advisable to have a telephonic conversation. Even more dangerous is the WhatsApp communication. अब सामने वाले ने आपको किस मूड में मैसेज भेजा है और आप किससे लड़के, किससे खुश होके, किससे होके उस मूड में उस मैसेज को पढ़ रहे हो, you don't know. You can't. So WhatsApp conversations can be really, really dangerous. Especially it can be misinterpreted, misunderstood by many. So I always encourage a face-to-face talk. Now colleagues will say, if we keep on talking, when we will work? Who told you to work for 8 hours? Only divide your part into the consultation part. You can say removing there will be a patients who will be having complaints. There will be patients who will be needing consultation. Of course, majority of the time, you can say 80% of the time you should be devoting to the treatment part. But you should dedicate separate time for consultation. And if somebody doesn't turn up, treat that as a tea break, treat that as a free time. So it does not mean you have to work like a machine from the time you enter into your clinic to the time you leave your clinic. There should be room for space. And when you give some space for recollection, thinking, you will always have less room for errors. So never ever encourage telephonic consultation, especially related to charges, especially related to features, especially related to benefits. Always encourage the patient to come. And if you don't have those skills, develop those skills. And if you like this video, please do share with your colleagues and please do subscribe to my channel. Thank you so much. And I will see you very soon in the next video.